started your timer, and here is your question. Right. So if you have read and understood considering its surgical and optimization, kindly please tell me, what are you looking at in picture on the on picture on the right hand side, picture A.
I'm looking to the dorsum of the hand, of the right hand.
Okay.
And showing tendon and muscle.
It's most likely left hand.
Yes, left hand.
Yes. Okay. Can you tell me what is this area that you are looking at? What does it call?
This is a snuff box.
Yes, anatomical snuff box. Can you tell me how is it formed?
Okay, it formed from anterior medially and posterior medial and anterior lateral. The posterior medial is abductor pollicis longus and extensor pollicis brevis, and the posterior medial extensor pollicis longus.
All right. Can you tell me what are the contents of the anatomical snuff box?
It has a scaphoid bone and radial artery.
Okay. So the base is, or the floor is formed by the scaphoid bone.
Scaphoid.
Yes. If a person falls on an outstretched hand and afterwards complains of a pain in the hand, how would you rule out, or how would you confirm the diagnosis of scaphoid injury, scaphoid fracture or dislocation?
Okay, I will make X-ray, and this is X-ray show if it's fracture or avascular necrosis in scaphoid bone.
How quickly would the fracture be able to be seen in X-rays? All right. How would you manage the fracture of the scaphoid bone?
I will make a slab and ask for rest if it undisplaced. If it displaced, I will make open reduction and internal fixation.
Scaphoid bone, it gets its blood supply from where and with which vessel?
It has blood supply from distal, so it can go from distal to proximal. So the most part to necrosis, it will be the proximal part. And what is the blood supply? What's the name of the artery?
Yes, you didn't tell me.
The dorsal arch.
All right. Can you please tell me why the scaphoid bone can end up with avascular necrosis?
Because blood supply come from distally, and it was by retrograde. So the proximal part, it will be at least of blood supply. So this is liable for vascular necrosis more.
Okay. Can you Right. If you're looking at the left-hand side image, can you please tell me what is this number 16?
Extensor retinaculum.
Okay, can you tell me the attachment of extensor retinaculum?
Okay, it's bisiform and hamate. It's from medial side, and from lateral side will be scaphoid and trapezium.
What are the structures which passes below the extensor retinaculum?
It will be extensor digitorum longus, extensor digitorum and extensor carpi radialis and ulnaris and brevis and longus, and it will be the extensor pollicis longus, and abductor pollicis longus, extensor pollicis brevis, and extensor digiti minimi.
So how many tendons are passing below the extensor retinaculum?
How many? I don't know actually.
And how many canals there are?
I don't know.
Do all tendons have their separate synovial sheath in which they are passing, or are they all passing together in one? Okay. Can you tell me how the wrist joint is formed, please?
Sorry, how
the wrist joint? This is the wrist
how
joint?
the wrist joint? Okay.
Yes, please.
It will be 8 carpal bones with the ulnar bone and the radius bone and metacarpopharyngeal bones distally. All of this makes the wrist joint.
All of the 8 carpal bones articulate or yes?
It's between the 8 carpal bones and the other.
Not all of them. So can you name the carpal bones which are involved in the formation of wrist joint, please?
Okay, scaphoid and lunate, hamate.
How many? You said 8 carpal bones. Can you name the carpal bones?
All of them?
Yes. And how would you order them in like upper and the lower?
Okay, I will start from proximal to distal.
Yes.
And from lateral to medial. Scaphoid.
Yes.
Lunate. Bisiform. Sorry, traquetram, so before bisiform, and then bisiform, and after this it will be trapezium, trapezoid, capitate, and hamate.
If a patient comes to you with the fracture of a wrist joint, you suspect injury of radial nerve, how would the patient present?
It will be drop of
Wrist drop,
fingers
yes.
of wrist.
Yes, and
loss of sensation of the dorsal palm laterally, 2/3 laterally, and 3.5 finger laterally too, without except the tip, dorsal tip.
What are the movements which are present at the thumb?
Sorry, what's the movement?
Movements which are present at the thumb joint.
What's the movement in the thumb? It will be what's the movement lost or
no,
intact?
what are the, yes, thumb is capable of which movements, please?
After radial palsy.
No, not after radial palsy. It's a separate question.
Okay, it will be abduction, adduction, flexion, extension, and opposition.
Okay. Right. We're moving onwards. Can you please look at, okay, if if we are looking at the right-hand side image, can you identify 19, please?
It's flexor retinaculum.
Yes. We discussed that yesterday. All right. If you can identify this 31.
Ulnar nerve, ulnar artery,
Okay. And what is this 29? Please.
palmar arch.
Okay. Moving here on the picture 8. If you can identify number 12.
12, it's flexor indicis.
Okay, can you write on? No, I don't have that image, but no, I don't have that image. But you were telling me about the blood supply of the hand.
Okay, blood supply of hand, it will be ulnar artery and
So
medial artery.
superficial palmar arch, how is it formed? Would you be able to identify it here in these two images?
Okay, it will be number 29 with 8.
Okay.
And in the second image, I can't see exactly the palmar.
Right. So
but
this superficial palmar arch supplies what?
it supplies the palm of the hand. It supplies the hyposthenar and thenar muscle. It supplies the finger proximally and distally. It supplies the carpal bone, metacarpal bone, and distal phalanx and proximal phalanx.
Okay.
Yes.
I was thinking more like that you'll tell me how they contribute in palmar metacarpal artery, information of that, and how they form 3 common palmar distal arteries, which arise from the arch here. If you could see where is cursor, 1, 2, 3. So they're arising from the arch.
Yes.
And then they are also supplying the lumbricals, 2nd, 3rd, and 4th only. Right. How would you rule out ulnar nerve palsy?
Ulnar nerve palsy, I will ask the patient to adduct the thumb or with foramen test, and maybe I can test the sensation of dorsal or palmar 1.5 finger medially, and for a third of dorsal and palmar of the hand. And I will ask the patient to see if he can capable of make the abduction, sorry, with his thumb.
Have you heard of a test called Allen's test? How is it performed?
Yes, I will ask the patient to elevate his hand, and I will pressure on the lateral and medial side over the radial and ulnar artery for 3 minutes. And after the color become white, I will remove my hand over the ulnar artery. If the hand become erythematous and red again, so the hand supply 70% in people with dominant ulnar nerve.
Okay. Thank you.